Namaskar to everyone. Today I will be talking about female infertility. Female infertility, how does it happen and why does it happen? I will be giving you detailed information about this. So please continue watching my video till the end to get full information about the female infertility. So let's begin our video. The term female infertility occurs only when you have tried to conceive for 1 year, even during your ovulating dates, and you were not successful in conceiving, or you have conceived successfully but you have early miscarriage. If these two conditions are fulfilled, then a woman can be considered having woman infertility. Before jumping into the issue of female infertility, let's discuss in detail what happens if a woman conceives and what happens in the body of a woman after conceiving or even before conceiving. What are the processes the body requires to make the conceiving into a pregnancy? So first thing first, the brain has to send a reproductive hormone signal to the ovarian glands so that it starts its work. So this is the first pre-requirement of the body. It produces egg. So a good reserve of egg is essential for getting pregnant. If we talk about the statistics, about 1 million eggs are there in the ovaries of a newborn girl child. But as the time passes, by the time she is at her teenage, only 3 lakh eggs are left. And as the age moves further and the woman tries to conceive, the egg quantity decreases rapidly. By the age of 35, only 15% eggs are left. And by the age of 40, only 5% eggs are left in the ovary. After that, a mature egg must be produced in the fallopian tube. The male sperm enters the fallopian tube through the female cervix. It crosses with the egg and forms an embryo. And this embryo goes into the uterus lining and get attached to the uterus lining. So it gets the required nutrition and oxygen. So this is the basic process essential for getting pregnant. So the major emphasis on the eggs and the egg quality. So there are many women who have irregular periods. Some may have 32 days cycle, some may have 21 days cycle or even less. 28 to 30 days is ideal for the good period to have ovulation. If this process is disrupted by anything, then the ovulation process will be disrupted, and if there is no egg, then there is no point of getting pregnant. So ovulation process may be disrupted by many causes. The major cause is PCOS, polycystic ovarian syndrome, in which the female ovulation process is interfered by the hormonal fluctuations and the ovulation process is not regular. This is one of the cause. The other cause is POI, means primary ovarian syndrome, in which the ovary stops working, which is ideal after the age of 40, but sometimes many women experience the same before 30 also. The other cases are, there is a blockage in the fallopian tube. So the egg is there, the ovulation is there, everything is perfect, but fallopian tube is blocked by some cause, some cyst or something. So the egg is not getting into the uterus. The other may be that you have the fibroids. The cyst is there in the uterus. So the eggs are not getting implanted or getting attached to the walls of the uterus. This causes miscarriage issues. Sometimes the uterus thickening, or what you say epithelial thickening, is not as per the requirement, that is, it should be at least 7 mm. If it is less than that, then there will be chances of miscarriage. If the thickening is more, then there will be disruption in developing of the baby, causes female infertility. And if your all process is clear, then it is the male infertility that causing you getting not pregnant. So if you want to have any detail of any of the syndromes that I have talked, please do comment. I will make a detailed video. If you like my video, like my effort, please do subscribe to my channel, Mom's Guidebook.